Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to join us for this hour, and we're looking forward to having a vigorous exchange of information and ideas affecting our community. Without further ado, I will pass it over to our founder, Dr. Randall Maxey.
Thank you very much, Dr. Barbara Neighbors-Stevens. I want to start things in just a little bit different way before we go to our topic. When we first started, we would introduce each of our co-moderators. We haven't done that for a long time, but I think I just want to remind everybody the caliber of the people that I have joined me every week. Let's start with Dr. Hines and Dr. Walks, and then Dr. Neighbors-Stevens and myself, just a 30-second introduction of who you are and what you do.
So good afternoon, everyone. My name is Jocelyn Hines. I am a family physician. I am the Chief Medical Officer for a company called Complex Care Solutions, and I've been practicing for about 15 years. I'm based in Maryland.
Good afternoon, everyone. My name is Ivan Walks. I'm a psychiatrist. I have a practice, Ivan Walks and Associates. Our clinical structure is called Integrated Health Resources. Currently licensed in California, Virginia, Maryland, and Washington, D.C. Can't figure out where I want to practice, but I keep practicing. I've been a doc for a few decades now. Didn't have any gray hair when I started.
Good afternoon. My name is Barbara Neighbors-Stevens. I am a pediatrician by specialty, but I have been pursuing administrative medicine since 2000. I currently work for a company called Molina Healthcare Incorporated, which is a Medicaid, Medicare program headquartered actually in Long Beach, but has expanded to several states throughout the nation.
And I'm Randall Maxey. I'm a specialist in internal medicine and nephrology, which is kidney disease. And I also have a PhD in cardiovascular pharmacology. And I've been practicing for a few more decades than Dr. Walks. And we're now ready to talk about the heat. As you know, that we've had the hottest period.
Robbed in the finals last year, Dr. Maxey.
What's that?
Oh, we're not talking about the Miami Heat? I'm sorry. Go ahead.
I want to talk about the heat. That's real heat. And heat has major metabolic and medical effects on people. And I know I'm about to take a trip to New Orleans for the National Medical Association, and I've invited Dr. Neighbors-Stevens. She refuses to go, but it's hot down there. And I noticed that, especially in the Southeast, it's been really hot and humid. So let's put up the first slide, Simon. And I would invite my co-moderators to speak on some of these slides as we go. We want to give you tips and look out for those alligators that Dr. Neighbors-Stevens brought up from Tampa. As many of you know, I have sometimes a sight impediment, so I ask my co-moderators to help me with some of the slides. Go to the next slide, Simon. So there's something called cardiorespiratory fitness, and it's been linked to cancer risk and mortality. We know that many of us younger people are trying to be fit, walk and run every day and work out in the gym. And there are higher levels of cardiorespiratory fitness that may offer protection from colon cancer, lung cancer, and from lung cancer and prostate cancer. Next slide. So you want to be fit. We know that there's benefits of being fit. There are higher cardiovascular fitness levels may be associated with significantly lower risk of colon cancer. And that risk factor is 0.72 for moderate and 0.63 for high fitness. Let's go to the next slide.
Dr. Maxey, are you going to define cardiorespiratory fitness?
it means that you're able to breathe with a certain level of oxygen intake, that your cardiac abilities make you more functional, that your blood pressure is well controlled. And those are what I call cardiovascular fitness without getting into high technology. Do you have another definition you'd like to add?
Well, some people attach the resting heart rate and maximum heart rate reached during exercise as part of that as well.
And recovery time, right? So after you exercise, how long does it take for your heart rate to come back? After you stop exercising, how long does it take for your heart rate to get back to normal? So the longer it takes for your heart rate to get back to normal after you stop exercising, I'm summarizing, the less fit, right? So the more fit you are, your heart rate will go up, meet the demand for exercise, right? And then when you stop exercising, it'll come back down, to wherever your baseline is. And the more fit you are, your heart rate won't necessarily go quite as high as it will, like when you exercise, as it will for those of us who are less fit. So for example, lots of times you'll do those calculations for what's your target heart rate, for your age, on the different machines or those kinds of things. When you first start exercising, you might find out that a little bit of walking, right, can get you to that target heart rate. And then as you keep exercising, it will take a higher level of intensity to get to that target heart rate because you are becoming more fit in your cardiorespiratory system.
So
on one of our next sessions, I want to go a little bit more into detail because this is queered by the fact that so many older people are taking medicines like beta blockers, eye drops, that have things that don't give you a good resting heart rate in the first place. So it's going to be different. We need to define some of those. But in truth, you're right, Dr. Hines, that how you recover is good. But one person may have a resting heart rate that's healthy at 80 and another at 60. So we have to go a little bit more detail in that. Dr. Walks?
So let me give a concrete example. I like numbers, and this is the weekend of the United States track and field championships. And the technology is amazing now. They've strapped these sort of Fitbit kinds of things on the athletes. Before the women's 100 meters, before the race, they were showing one of the runners whose resting heart rate is 61. And just before the race started, her heart rate was up to 160. Now, if my heart rate is at 160, it's about to stop and someone needs to call 911, which is why we always talk about consulting with your physician. As Dr. Maxey just said, we all need to know what's normal for us. So having a doc, a family practice doc, a nurse practitioner, someone that can tell you when it's healthy for you to exercise. Don't just go out there and sign up for the next marathon. It's really important that we understand this. So Dr. Maxey, I think it's great that we can go into more depth on this because it's something we can all get outside and walk or run. And if we don't do it carefully, we can have some consequences that are not good.
Okay. Well, looking at hot weather, extreme heat is defined as summertime temperatures that are much hotter and are humid than our average. And because some places are hotter than others, this depends on what's normal, average at where you live in that location at that time of the year. Humid and muggy conditions can make it seem hotter than it really is. Next slide. So there are heat-related illnesses, such as heat exhaustion or heat stroke. They happen when the body is not able to properly cool itself. The body normally cools itself by sweating. During extreme heat, this might not be enough. In many cases, a person's body temperature rises faster than it can cool off. This can cause damage to the brain and other vital organs. In fact, it can cause decay of muscle, kidney failure, and you can actually die from being too hot. Next slide. So heat-related illnesses. Dr. Walks, would you help me with this slide?
Absolutely. The first bullet. Some factors that might increase your risk of developing a heat-related illness will include high levels of humidity, obesity, fever, dehydration, some prescription drug use, heart disease, mental illness, poor circulation, sunburn, or alcohol use.
Next slide, Simon. So heat exhaustion is a condition that happens when your body overheats. Symptoms might include heavy sweating, a rapid pulse. It's one of 3 heat-related illnesses, with heat cramps being the most mildest one, and heat stroke being the most serious. Causes of heat illness include exposure to high temperatures, particularly when there is also high humidity and strenuous physical activity. With prompt treatment, heat exhaustion can lead to, without prompt treatment, heat exhaustion can lead to heat stroke and life-threatening conditions. Fortunately, heat exhaustion is preventable. Next slide. I want to do this one again. Dr. Hines, would you mind doing this? And then I'm going to come to Dr. Neighbor-Stephens. And you can comment more on each one as you want to.
Symptoms of heat exhaustion may start suddenly or progress over time, especially with prolonged periods of exercise. And they could include cool, moist skin with goosebumps when the heat, heavy sweating, faintness, dizziness, fatigue, a weak but rapid pulse, low blood pressure upon standing, which is usually going to make you feel dizzy.
I can't hear you right now.
So the other ones would be muscle cramps, nausea, and headache.
Now, all of these can be affected by the medication you take, especially taking diuretics, beta blockers, high blood pressure medicine, and even some psychiatric medicines, Dr. Walks, are affected, especially in heat. And even though I'm aiming this mainly at people in Dr. Walks' age group, this is doubly important for children and babies, that we have to be concerned about them and not leave them in cars, and be careful about even when we have them out in the park and run up and down the slide. We all have to be careful about people not being able to get rid of heat. Next slide.
Can I just add to
I
that?
would also, but before we move on,
Yes.
I was just
Go ahead,
also going to
Dr.
say for your recreational folks, right? You're outside playing, it's a lovely day. Even being out, for example, at a pool or at the beach, sometimes you may not notice some of these things because you're in the water. Sometimes that tiredness that you feel from the sun could easily be, dehydration, dizziness. You're on your way, but you may not even notice it in the water, but water's not on the inside of your body. So just something to think about. And then other times too, like athletes in particular, there used to be a time when, for your athletes, when you were exhibiting these symptoms and complaining about them, they were seen as a sign of weakness, right? Push through that headache, push through that nausea, just go ahead and throw up and keep it moving. Luckily, for the most part, that's not the approach that's taken anymore, but it's still something to think about when you're out there insisting on going for your morning, mid-afternoon jog. That's when you usually go, but also degrees and 80% humidity, that may not be the best time to do that.
Thank you. Next slide, Simon. Dr. Neighbor Stevens?
When to see a doctor? If you think you have heat exhaustion, stop all activity and rest and drink. Move to a cooler place, water, that is, drink cool water and I'm going to be very careful about how I say this, hydration drinks, because apparently there's, we can maybe talk about this a little bit later. There's controversy right now about some drinks that are being excessively consumed apparently by people under 18 in their in the energy drink category. And what we're talking about are the hydration drinks. Contact your doctor if your symptoms get worse or they don't improve within an hour. If you're with someone who has heat exhaustion, seek immediate medical help if they become confused or distressed, lose consciousness, or are unable to drink. If their core body temperature measured by a rectal thermometer reaches 104 degrees or higher, they need immediate cooling and urgent medical attention. Now, let me comment on this. As a pediatrician, rectal temperatures are what I love to hear about. But if you're talking about in an emergency situation, I doubt that you'll have a rectal thermometer in your pocketbook unless you happen to have a young child with you. So if you have any instrument that can take the temperature and you understand how to use that instrument, and by that I mean you understand what its reading is relative to 0 and 32 degrees so that you understand what it's really saying, don't get hung up on the rectal thermometer, because what we don't want to see is someone whose internal temperature, which is most accurately measured by rectal temperatures, we don't want to see them above 101.
So just splash some cold water on me. Don't take my rectal temperature. Next slide, please. Those excellent points, Dr. Neighbor Stevens.
Only a pediatrician would think about it.
So heat stroke. Without prompt treatment, heat exhaustion can lead to heat stroke, which is a life-threatening condition that requires emergency medical attention. The management of heat stroke is giving them fluids and dunking them into a cool ice water bath as quickly as possible. A common symptom of heat stroke is an altered mental state or behavior, and that is the key right there. That's the pearl. Look for confusion. If they're confused, they're having heat stroke. If anybody is in the heat and they're feeling nauseous or just not quite right, they should take a break, hydrate with cool water, and just sit down and let their body cool down. Dr. Walks, I know for a fact that some people taking medicine for mental health have problems in heat too. How will we differentiate between something going on in that realm and confusion from heat stroke? Is there something we might know about that?
Dr. Maxey, I would recommend that we not take time to differentiate, because heat stroke can be absolutely deadly. So if someone is looking confused and they're in the heat, especially if they stop sweating, you want to get them. The one thing I would add to this slide is that they should take a break, hydrate, get out of the heat, hydrate with cool water, and just let yourself cool down. And after you make sure that they're not about to have a real problem with heat stroke, then you can begin to ask questions about differentiating whether they took their medicines, whether they had some sort of a change in their mental status that is not unusual for them, or someone who is a loved one or someone who is with them can tell you about what their normal reaction is. But when someone is in the heat and experiencing these symptoms, you want to get them out of the heat, get them some fluids, calm them, help them to cool down. That would be my advice. Now, I would love to have Dr. Lawson, who is with us and is a psychiatrist extraordinaire, to see if Dr. Lawson has something else to add to this concern about mental health or the status of mental health folks.
But first, did he invite you to have barbecue at his house yet?
No, man, you know how he is.
Not no, I just want to thank you for bringing this up. I just want to say there's a lot of literature now showing that there is a relationship between the climate and certain kinds of, quote, violent behavior. People not only become stuporous, but they also show problems with impulse control. And so it's not something you can do in a particular individual. But what we're finding is there's some real issues in terms of certain parts of the world, certain parts of the country, especially now when there's a worldwide pandemic of heat that's infecting a lot of cities. It's not just crowding. There's something about the direct stimulation of the hypothalamus in terms of these kinds of extreme temperatures. But saying that, also, I'm glad you made the point also, don't bother to differentiate, because unfortunately, some people do become confused, don't know what's going on, and you don't know, is this because they had too much alcohol, for example, or drugs of abuse, or is it just that they've been out in the sun too long? And one of the interesting things that happened, as many of you know, is that the sensitivity to thirst disappears, and people stop drinking fluids when they've been exposed to heat for too long. So I think those are all excellent points. It's not something that you take lightly, and especially folks that are on some of our more common, quotes, leisurely drugs like alcohol and others, they can very quickly go into a situation in which they're in deep trouble health-wise.
You know, one of the things that comes to my mind, and maybe I'm being a bit cynical, but my mom and aunt used to always take me shopping in the summer, and they'd shop from dawn to dark. And I know the shopping centers now are more air conditioned, but sometimes that hard work of shopping all over the city in the heat, that can bother you as well. So we need to be careful about that and not put it to the side. Let's go to the next slide.
Can I just add one more thing about putting people in that cool ice water bath? Because I've actually been in a scenario where I was with someone who was experiencing heat stroke. And sometimes you don't have those things. You're not in a position to do that. We weren't. We were at the Grand Canyon, and we needed to drive to the nearest, hospital center. But one of the things that you can do in the meantime is you want to put ice packs, if you have them. You could we stopped at the 7-Eleven and got frozen peas, right? And you stick them in the armpits and in the groin area. Because and on the neck, right? And because those are places where you have a lot of blood flow, and that's a good place to put ice or cooling things to help somebody cool their body down until you can get to wherever the hospital destination is.
Excellent point. Excellent point. And in this slide, I just wanted to demonstrate that also you can get seizures, which can be a part of this, and rhabdomyolysis and kidney failure can happen. But the key thing is the mental confusion that you want to do an assessment on. Let's go to the next slide.
So Dr. Maxey, I know you touched on this earlier when you talked about blood pressure change when someone gets up. Dr. Gibson wanted to make sure that we emphasize that is orthostatic hypotension, so that when you get up, your blood pressure doesn't get up with you, and so folks can get up and fall down.
That's very true. And that can happen from sometimes diuretics, from the sweat that you lose, and you even lose fluid by breathing. Mm-hmm. And I read an estimate that you lose 1,500 cc's of fluid a day just by breathing alone. So it's not just urinating and taking diuretics, but it can also be the amount of breathing that you do. So what about prevention? Would you read this, Dr. Watts?
Happy to. Prevention. Overall, prevention and response to heat-related illness may vary under different circumstances. Dr. Hines just gave us a great on-the-ground, real-time example of the frozen peas from 7-Eleven can be a lifesaver. So those kinds of things can be absolutely critical. Second bullet, urban settings may have more older, lower income, and minoritized racial and ethnic groups who are more susceptible to heat-related illness, but who may live closer to medical facilities.
So this
So-
goes back to our discussion before, redlining and the
Dr.
fact that
Can
many,
we spend a little time on this, because this is a subject that, and I personally am trying to make sure that when we bring up an issue, we need to talk about solutions. Absolutely, prevention is the number one thing in our toolbox, is to prevent it from happening. But what are some other things that we need to do to help decrease the incidence of this? And this is a really serious issue because we're only going to get hotter. They said this may be the coolest summer that a lot of places see for the next several decades, unless there's some really significant changes in the way we address our carbon emissions. I've heard some very interesting discussions about urban response to this. Interestingly, I really haven't heard much about rural response, but urban response to this issue includes municipalities establishing cooling centers, even shelters for people who do not have air conditioning. We know that the urban center is going to be hotter because the street absorbs the heat and we don't have the trees to help shade and cool things down. One of the things I heard that I thought was very innovative, some group outfitted a school bus so that it became a mobile cooling station. I'm bringing this up because wherever you live, I'm willing to bet you got this issue in your city or your town. And as a citizen of that community, you need to hold your municipal officials to feet to the fire to address these issues in ways that will prevent death. We're not talking about something that is just making you uncomfortable. This is a condition that can lead to death.
maybe we should go to the next slide, Dr. Neighbors. I think somebody to address.
Let me add to what Dr. Neighbors-Stevens is saying, and maybe it's on the next slide. But let me just make this comment. Finding out these things is what it's in addition to making sure they're happening, finding out what is happening. A lot of jurisdictions do have cooling centers. Dr. Maxey mentioned the shopping centers, movie theaters. There are a lot of places where they keep things cool, and you need to know where those things are.
Don't leave out the libraries.
Don't leave out the libraries.
That's also the reason why some states are now moving to free public transportation for this reason, to allow people access to air-conditioned buses and things of that nature.
But my point that I want to get over, besides these great ideas that are being floated around, is to look at what's happening where you live and be an advocate for the changes necessary where you live with your city officials.
Okay. Good points, good points. Next slide. So I read a review from the Death Valley Guide, and they had developed some policy advisories for people that they should drink between 24 and 42 ounces of water per hour if there's high heat. And we know that the heat in Death Valley is ridiculous, above 120. So they're recommending in that type of heat is between 24 and 32 ounces of water per hour in high heat. They also noted that some people would drive from Vegas for 2 hours, spend an hour and a half hiking in the 120-degree heat with only a 12-ounce water bottle. And they didn't eat, and they haven't been drinking. So heat exhaustion will obviously creep up on them. They also recommended salty stacks while out in the heat, other forms of electrolyte replacement. But he warned against some of these drinks that have a lot of sugar in them. And if you drink too much sugar too quickly, it can lead to nausea and vomiting. So we want to look at hydration drinks. We want to be concerned how much caffeine is in them, because that can increase your heart rate in a way that shouldn't be done. And we also want to make sure that the sugar level is not unduly elevated. Next slide.
Before you go, I just want to say the story that I was referencing before. There were 3 of us who went to the Grand Canyon, and we made all of these mistakes. And there was a guide at the Grand Canyon who saw us going down the path, and he said, how far are you guys going? And one of the people that was with us said, he's going to go over to the, go all the way down to the bottom and, come up to the other side. Now, myself and the other lady that was with me, we weren't doing that, because I'm seeing, as I'm going down, I'm seeing all these other people who are half passed out. People are crying because they're exhausted and tired. But that is exactly what happened. We went. We had a regular, we had more than 12 ounces, but it was a regular water bottle. No one had eaten anything. I think the one guy had a banana. And we didn't have any snacks. And he did not heed the warning and went on, did exactly what he planned to do. We turned around because I realized that this seemed kind of awkward, all these other people. So then we came back up, and we ended up meeting him a couple hours later where we were supposed to. He was late because he was confused. He was, it was a mess. As soon as we had already called the Rangers to kind of be looking for him, because it had gotten really late, but we made every single one of these mistakes on this paper. Well, we didn't, because we turned around, but the scenario, we were unprepared is what I'm trying to say.
The key thing about many of us, we overestimate our physical fitness and what we can do. So we have to be more. Next slide. So Dr. Walks, you want to do this one?
Sure. This is about delayed heat exhaustion. And again, from the Death Valley Guide. Point number 1, heat-related emergency calls in the hottest season tend to follow a pattern. There are 2 periods. Calls will come in. One is midday for someone on a trail who might be experiencing heat exhaustion. The next wave of calls, we're told, comes late at night around 10 p.m. or even later, after people have spent the entire day hiking, and then they get back to their hotel, realize they're feeling ill, and start to develop some of the symptoms of heat stroke. Progression of heat-related illness may occur over many hours, can happen if someone has been exposed to outdoor heat for longer periods of time, or hiked extensively during the day.
So the lesson here is that it's not just something that can happen then, but when you get back to your hotel and you think you're cool, you can still get sick. So you still need to be observant of yourself and whoever is with you in that heat, because it can come back on you.
Can I just say, Dr. Maxey, that I have an issue with this slide, because you don't have to go to the Grand Canyon or Death Valley or on a hiking trail. You can just be trying to walk to church and back. You can be trying to walk your kids to summer camp and back. As Dr. Neighbor Stevens said earlier, these are issues in a lot of urban communities. So take this Death Valley thing and apply it to 29th and Western in Los Angeles, because there are times when we aren't doing any of the stuff we think is bad, and we're putting ourselves at risk.
Okay. It brings me to a thought. I was at Bishop Noel Jones Church some months ago, and we were taking blood pressures. As members come out from the sermon and all the things that we do in our churches, everybody had super high blood pressure. We'll comment on that later. Next slide.
Must have been a good sermon.
It always is. So would one of you read this one?
Delayed onset of heat exhaustion. According to the CDC, heat exhaustion can develop even several days after exposure. The Mayo Clinic also says prolonged periods of exercise can lead to heat exhaustion's progression over time instead of a sudden onset. For heat-related emergencies, rapid cooling is the standard of care. Immersion or dousing in cold water, removing clothing, applying ice packs or frozen peas, fanning, elevating feet, and monitoring airway and breathing. For milder cases, patients should seek shade or air conditioning and sip cool fluids.
Next slide. So there's another heat-related problem, and Dr. Gibson suggested this. I looked up some of the articles that he sent. Maybe one of you could go through this with me. It's kind of small looking for me.
Sure.
I'll take it.
Go ahead.
So kidney stones in kids. 30 years ago, kidney stones were considered a disease of middle-aged white men. Now doctors are increasingly seeing a different kind of patient suffering from the extremely painful condition, especially during summer. Kidney stones are hard deposits of minerals and salts that can get caught in the urinary tract and are now occurring in younger people, particularly among teenage girls, is what the emerging data is showing. Experts aren't sure why more children and teens are having these kidney stones, but they speculate that a combination of factors are to blame, including diets high in ultra-processed foods, increased use of antibiotics early in life, and climate change are causing more cases of dehydration.
Next slide. Go ahead, Doctor.
So kidney stones in kids. The research published in the Clinical Journal of the American Society of Nephrology found that the annual incidence of kidney stone disease rose 16% from 1997 to 2012, with 15 to 19-year-olds experiencing the greatest increase. Within this age group, kidney stone incidence was 52% higher among girls and women. The disease became more common in men beginning at age 25. Wow.
Next slide. Overall,
kidney
ahead.
stone disease doubled during the childhood for boys and girls, while women saw a 45% increase of risk in their lifetime over the 16-year period. Black adults and children in the study also developed kidney stones at greater rates than whites.
Let's go to the next slide. So high amounts of sodium from potato chips, sandwich meats, sports drinks, and packaged meals can force extra minerals into the urine that can clump into kidney stones. It's especially likely if a child doesn't drink enough water or drinks too many sweetened beverages with high fructose corn syrup. It's like trying to dissolve a piece of sugar or some sugar in a nearly empty cup of coffee, a urologist stated. Next slide. Dr. Mark, go ahead.
Cause more hot and humid. The more you sweat and less you urinate, allowing minerals to bond in the kidneys and urinary tract. Children are especially vulnerable to heat.
Next slide. And Dr. Neighbor, being the pediatrician, I want you to comment on this antibiotics.
Kidney stone belt. Studies have found that the number of people seeking medical care for kidney stones increases as daily mean temperatures rise. Other research shows that the southeastern US, known as the kidney stone belt, has as much as a 50% higher prevalence of kidney stone disease than in the Northwest. One 2008 study predicted the belt will inevitably expand upward, with the fraction of the US population living in high-risk zones growing from 40% in 2000 to 70% by 2095.
Next slide. And this is for you and Dr. Hines, if you both comment on this.
Link with antibiotics. Antibiotics may alter the gut microbiome in a way that favors kidney stone development. In 2018, researchers found that people who took any of 5 commonly prescribed oral antibiotics were associated with a 1.3 to 2.3-fold increase in the odds of developing kidney stones. The risk decreased over time but remained high for up to 5 years after taking the medication and was greatest when given at earlier ages.
I think there's one more slide.
Kidney stones in kids. The earlier a person develops kidney stones, the more time they have to develop a more severe form of the disease and long-term health issues associated with it. Some of the consequences include loss of kidney function, decreased bone mineral density that could lead to fractures, and a higher risk for heart disease in adulthood.
So one of the comments I wanted you to make on this is, do you think we give our kids unnecessary antibiotics too often?
Oh, it certainly happens, but I think that the statistics are showing that at least in terms of treatment in emergency rooms and pediatricians' offices, that there is a reduction in the amount of antibiotics given. I will tell you that many a parent and I have had some intense conversations around my refusing to give antibiotics to their children. When I first went into practice, one family said to me, well, when you go to Dr. So-and-so's office, you always get a penicillin shot before you leave. And I said, well, you're not in Dr. So-and-so's office, and that's not going to happen here. You're not going to get any shot other than immunizations here. So this has been a fight. There have been all kinds of policy statements. One of the conditions that was where antibiotic administration was overly done was when children presented with ear pain or otitis media. And that was an issue for a lot of reasons. First of all, the kid was hurting, and no parent wants their child to be in pain. Secondly, if they were hurting and often had fevers, they were not allowed to return to daycare if they were under 5, or possibly not go to school if they were school age. And so parents would demand if the kid had a problem, that they get antibiotics so they could be sure to be able to take them back to daycare the next day so that they could go to work. So there are a lot of things that enter into it. But at the end of the day, we have had a tendency in this country to overprescribe antibiotics, not only in kids, I might add. It's also a problem in the adult population. It's a little bit better than it used to be, but we still have room for improvement, for
I
sure.
have patients that call me and say, my left leg hurts. Can I have an antibiotic? What's your experience, Dr. Hines?
I second everything that Dr. Neighbor Stevens said, and I will also say another factor that leads to some of that pressure to prescribe is this whole consumerism of medicine space, right? Because you don't want to get a bad review or things like that, especially for employed physicians. Those things, like if you don't have your promoter scores, or if somebody goes on Google and gives you a bad review, it can have implications at your job. So there are absolutely other factors outside of care that are fortunately making their way into that doctor-patient space. I will also say to Dr. Neighbor Stevens' point about there is an improvement in that space. For Medicare in particular, there are actual measured goals around not overprescribing or giving unnecessary antibiotics kind of in the bronchitis space, right? So lots of people get the quote unquote bronchitis, but not the majority of it does not need antibiotics.
And one more point I want to make on this. I am not an anti-telehealth person by any stretch. I think it can be a wonderful tool to increase access. But one of the things that has been demonstrated with a lot of the for-profit telehealth companies is that they push pills. I was trying to think of a nicer way of saying it, but they push pills. They talk to you for 2 seconds and give you a prescription. So again, we've been talking about advocating for yourself. If you make use of a for-profit telehealth company, you want to make sure when you have your interaction that it is clear to you that what they're saying, it makes sense. You may or may not have enough information to determine whether or not it's appropriate, but you can certainly try to see if what they're saying to you makes sense. And if you have any question, reach out to another source to verify the necessity of whatever has been prescribed.
So I want a little bit more clarification of what you mean by for-profit telehealth. Many physicians' offices do telehealth.
Nope, that's not what I'm talking about.
I know that. That's why I wanted more
But
clarification.
I don't want to name any names.
It doesn't matter.
Yeah, it does.
You're talking about the people who push the blue pills.
Well, you don't have to be
There's some
telehealth.
related
No, I'm not
to
talking about the blue pill. I'm talking about the telehealth. Some of them are local, some of them are national companies where you can call in and with a complaint, and they will dispense their treatment.
But I just want to differentiate that between the practitioner. the
Yeah, I'm not
psychiatrist,
talking about a practitioner. I'm talking about I almost said one of the names.
So,
I'm talking about proprietary telemedicine services.
Okay. Anybody else want to comment on that?
I think to Dr. Neighbor Stevens' point, and it's kind of in the same space that we were talking about that I was mentioning before, where the goal is to have a happy customer, right? As opposed to the goal is to follow the standards of care. And in many instances, especially in the context of antibiotics, your common cold kind of symptoms, you're not really going to be able to delineate whether or not you have an ear infection in telehealth, right? Just from a conversation. I can't tell you whether or not you have pneumonia or need antibiotics because you have a cough in telemedicine. So we've talked about before what's appropriate for a telemedicine space and what's appropriate for an in-person evaluation. And some of what I think Dr. Neighbor Stevens is referencing is that space where not everything is appropriate for telehealth. And sometimes in the context of trying to have a happy customer or a returning customer, you give people what they quote unquote want instead of what may be best.
Excellent. Is there another slide left, Simon? Okay. We're about at the top of our, we have any questions or comments on what we've talked about? The thing is to be cautious in the heat, in the summer, with your vacations. Even though you're relaxed, you want to make sure that you're drinking enough water and make sure that you're having enough ability of your body to be cool. Any other comments or questions in the chat that we want to address?
Dr. Maxey, there's certainly a lot of agreement with the concern about some practitioners prescribing in order to make sure that the patients don't give a negative review. I think that's one that folks are connecting with. And I think the other thing in the chat that is important is that there is an indication in the chat and information about the White House Conference on Hunger, Nutrition, and Health. And I think it supports Dr. Nabor-Stevens' point earlier for us to know what's happening in our community locally and now as well nationally when we hear about these White House conferences. Oftentimes recommendations come out of those, recommendations come out of the national academies, and it's useful for us to know what is going on in our government, in our country. And Dr. Lawson has his hand up again.
Dr. Wofford, Dr. Lawson, go ahead. Dr. Lawson? Well, I want to just bring you back to what Dr. Wilbur Jordan always said. If you have your own primary care physician, you're not going to need to call all these pill-pushing telehealth sites. You want somebody who knows about your body, your condition, and your needs, if you're going to do telehealth at all, not necessarily somebody you see on TV just so you can get a pill.
There we go. Yeah. Just a point I want to make is that I think you may be given the telehealth. It's not a question of telehealth. I think it's a question of having physicians having constraints in terms of what we can prescribe or not prescribe. So I worked in the VA system where we had very kinds of tight rules about what medication you could use and not use. And sometimes it just wasn't addressed to the clinical needs of the patient. I work for a large telehealth group that actually has real restrictions in terms of how many medications you can prescribe, as well as in terms of the use of addicting medication, which a lot of the good telehealth groups have anyhow. So it's not the issue, not the telehealth, but whether or not you're working in a setting that requires physicians to practice in a way that's standardized and not necessarily responsive to clinical needs.
Thank you, Dr. Lawson. Anything else in the chat, Dr. Walks?
There's a question about receiving a copy of the slides, and I think that because we do have folks who are with us live, who are on Facebook and YouTube, there are many different ways to get the information. We also archive all of the programs that we do. So yes, is the short answer.
So we can go to the YouTube and go to Black Health Trust, and all the slides are archived there. And who was that asked that question? They want to communicate with me? Okay, well, we're about at the top of the hour. If there are no questions in the chat, I want each of our moderators to have a chance to have a final word. Dr. Hines?
Again, I think that we've covered a lot of points about, heat-related safety, and there are a lot of sneaky ways that exposure to heat can sneak up on you. And we didn't talk about this, but I just want to put in the little reminder that even people of color need sunscreen. That myth has not gone away. So just sunscreen, in addition to all the other ways to be prepared for heat exposure, sunscreen. Enjoy your summers.
Okay. Does Dr. Gibson want to make a final comment? He sent me a lot of good information. Dr. Gibson?
Yes, actually, earlier you mentioned rhabdomyolysis, and I think that's something that really is important because a lot of patients that have hypertension take statin medications, and that is usually the problem that the statins cause is rhabdomyolysis, which is muscle pain. So patients need to be advised about that. And someone else mentioned the importance of monitoring the salt content of the foods and the type of foods and the type of drinks that are given to people during this really, really hot weather. So my suggestion is be mindful of the sugar and salt content and your food and drink in the hot weather. And in addition to the sunscreen, put on a hat.
Excellent.
Dr. Dawes has her hand up. It was up earlier, then it went down, but it's back up.
Dr. Lisa Dawes, Jamaica.
Okay, my question was, in terms of for the young people getting antibiotics, does giving them pre or probiotics help? Or putting them on probiotics help? Because I have done that with my kids when they come home getting antibiotics, despite complaints. As my youngest one, she will only take it if it's gummy probiotics.
Dr. Neighbor-Stevens, that's your area.
Dr. Gibson says, yes, it helps, but go ahead.
Well, it is not a standardized recommendation, probably mostly because it hasn't really been studied that much in kids. It's been studied more in adults.
Does it help the adults then?
Studies indicate it does. Well, it depends on what you're talking about. What is it helping? The use of probiotics and after antibiotic therapy has been suggested for use in adults for sure, especially if they're having trouble with diarrhea.
I think Dr. Lawson wants to weigh in.
Dr. Lawson?
He was unmuted. Now
I just want to quickly mention, let's not forget our elderly. And again, as you get older, you lose the ability to respond as readily to temperature change. And there have been several tragic cases, especially one in Chicago a couple of years ago, where a number of people literally died in their homes because they simply were not as responsive to the temperature, to the heat wave, and simply didn't get enough hydration or anything else. So we've got to make sure they recognize the age difference in terms of responsiveness to temperature.
I am on call this weekend, even though I am by the beach. All our hospitals countrywide are running over capacity. We are over 170% as I speak, my hospital. We are seeing, beside a lot of more autoimmune, we are seeing a lot of people coming in now with, as you talk about, more kidney stones, more dehydration with really high CPKs. And I definitely think a lot of it is with the elderly, it's because of the heat. We had a gentleman who we admitted yesterday, came in had his mother died in England, went to England for the funeral, came back 2 months ago, and family called him on the phone, wasn't responding well. One of them visited him in Jamaica and actually said, he's just not thirsty, he's not eating, and brought him into the hospital. Now, granted, 3 months ago, this guy was fine. He is now in renal failure with very high CKs, And apparently 3 months ago, this guy was normal. I admitted him yesterday because when I saw him in the office, he was diabetic. Sugar was only about, in your case, let me translate for you guys, 140. So not that high. His CKs were high and he was in full renal failure and had no thirst, just a little confused, a happy confused and hypotensive. And we are seeing more and more of that. I wish we could do a study, but we don't have that much money here. But we are all are full. I turned down somebody yesterday, transferred from another hospital who is probably not going to make it from some viral disease.
Dr. Lisa, I'm gonna have Dr. Walk send a couple of $1 million down there so you can do that study. So thank you very much. Dr. Hines, you want to give your final comments or thoughts?
Dr. Hines already gave her final comments. She can give, maybe she
Okay.
has some final comments.
Okay, then Dr. Walks.
So
I
several
guess I'm
things.
confused, Dr. Walks, in the heat.
You need to get some Pedialyte. You're never too old for Pedialyte. Dr. Maxey, my final comments are, it seems that so often we talk to, or we talk with, or we hear from Dr. Lisa Curran-Dawes about resource needs in Jamaica. There are many of our communities that we've talked about that have resource needs. And it's important for us to recognize that, as we talked about earlier, that we have to know what's happening in our communities and we have to advocate for resources in our communities. The thing that I wanted to focus on today, with the excellent expert help of our good friend, Dr. Lawson, who's been with us today, there aren't simple answers. There aren't, if you see this, do that. There is awareness. We talk a lot about prevention, and it's important for us to understand that when we're going to put ourselves in situations that we think are just ordinary and normal, oh, well, I'm just going to go down the street and do this. I'm just going to go and do that. Understanding how things are going to impact us as individuals, the cardiovascular fitness that we started with today, we need to understand how this engine that we have, how it is working and how we can stress it safely and how we can protect it effectively. So I just think that it's important for all of us to recognize that as individuals, we need to get this information that we can give every Sunday and you can get from your docs and your practitioners, and then figure out how it applies to you, the individual, so each of us can be safe.
Well, thank you, Dr. Walks. Dr. Neighbor-Stephens.
Thank you, Dr. Maxey. I'm going to end on my usual cautionary term of use common sense. But specifically, I want to direct that use of common sense as we shop. And as Dr. Walks is saying, we're trying to do the right thing. Read your labels. It is so important that you read your labels on what you're about to purchase. Case in point, I alluded to this earlier. There is a relatively new energy drink on the market called Prime. I'd never heard of it. But anyway, and apparently it is being pushed by social media influencers. And the label clearly says not to be used by individuals under the age of 18 or pregnant or nursing mothers. And the reason for this is because it has a very high, over 200 milligrams of caffeine in its, I think it's 12-ounce can. Now, the reason that it is a problem for people under 18 is because that is a lot of caffeine. Well, that's a lot of caffeine for an adult, but that's a whole lot of caffeine for a kid, and it can have unintended consequences. It doesn't have necessarily the effects in a kid as it does in caffeine, that is, as it does in adults. So it really should not be given to kids to hydrate. However, there's heavy marketing targeting kids now. You're the cool kid that's drinking Prime. So parents, be aware, grandparents, be aware, read your labels, and not give your kids stuff that has a lot of caffeine in it, stuff that has a lot of salt in it, stuff that has a lot of high fructose corn syrup in it, or any of the other things that we talk about all the time on Black Health Trust when we talk about good nutrition. Just because it's summer doesn't mean that we can just let it all hang out. We can't.
But we do want people to have more salt intake if they're outside sweating. But let me ask you a question before we close, Dr. Neighbor-Stevens, and maybe we can do a show on this soon. Why is it that it's not recommended that infants, little kids, have frequent access to TVs, computers, and screens?
Yeah, we've had this conversation, Dr. Maxey. You don't want to, let me start over. Little kids, babies and little kids are sponges. They absorb everything around them. You want to be very judicious in what you expose them to. If what you are exposing them to is a screen and they're spectators of that screen, you are not stimulating them in interaction, which is what you want to do with young kids. You want them to interact with you. That's how they learn language. That's how they see how they come to understand how you think. If you are an analytical type person, and that's how you talk with them and you show them comparative things like, this is why I go to Dollar General, because I can pay half as much at Dollar General as I pay for this at the grocery store. That helps them, that interaction helps them to develop their critical thinking skills. Plugging them in front of a screen, looking at a game or cartoons may do something for some eye-hand coordination. There's controversy about that, but it definitely isn't doing anything for that interaction and cognitive stimulation.
Any other thoughts on that? Dr. Hines, Dr. Walks, Dr. Lawson? I guess not.
Dr. Maxey, Dr. Sherrod just raised her hand. I think she probably has some thoughts on that.
Dr. Sherrod?
Good afternoon. Yeah, thank you so much. I agree with what Dr. Neighbor-Stevens has said, but also there's also a physiological effect of the electromagnetic frequency on these young kids because their brains are rapidly developing. It can really cause major problems in brain development with overexposure to electromagnetic frequency. And it's a long range of things that it can result in. So that's one of the major factors, is the fact that their cells are rapidly dividing because the brain is rapidly developing. In fact, most of the brain, 80% of the brain development is done by the age of 2. So you don't want to expose them to the electromagnetic frequency during this period because it interferes with normal brain development.
Excellent. Any other thoughts?
So I'll add, Dr. Maxey, that everything in moderation, right? So it's not that you never want your kids in front of a screen, you never want your grandkids in front of a screen. It's that too much is too much. And what they watch is probably as important, if not more important. A lot of really bad things are on screens of all types. And so you want to make sure that, and a lot of good things are on screens. I still remember my electric company and my conjunction junction, what's your function? There's some things that we can get very well through screens. So yeah. That's all I'll say.
Any thoughts on that?
I think it's complicated, right? And I think Dr. Waltz summed it up, right? there are benefits and detractors from lots of things in the screen space in 2023. Technology opens a lot of door, but if we're talking about little kids, the values are diminished if we're talking about the people that are under 2, right? But in kids, there are spaces where there are positives in places for technology and screens and the like. And then, as Dr. Walk said, too much of anything is not a good thing.
Okay, so one day I want to talk
Except
about
ice cream.
Big Bird
Except ice cream. We love ice cream.
and Miss Rachel. And thanks, everybody. We had a good Sunday discussion. Welcome back next Sunday. We'll be back. Everybody have a great day. Have a good day. Thanks, Simon.
Thank you, Simon.